Good afternoon. My name is Sarah Weiner, Program Manager of Education and Practice at the Association of Schools and Programs of Public Health. Thank you for joining us for today's ASPPH Presents webinar, Introducing the Public Health Law Competency Model. Today's webinar will be 1 hour in length. The presentation portion will last approximately 30 minutes, followed by a question and answer period. This webinar is part of the 2016 ASPPH Presents monthly series, which has been designed as a service to CEPH-accredited ASPPH member schools and programs of public health. This webinar is being recorded and it will be available on the ASPPH website in the archived webinar section soon. Additionally, this webinar has been approved for 1 hour of CPH continuing education credit. A few housekeeping items of note. While you are in listen-only mode and your lines have been muted, we encourage you to ask questions throughout the presentation by using the question box. We will address your questions at the end of the presentation. I'm pleased to introduce today's speaker, Montrese McNeil Ransom, who currently serves as the Team Lead for Public Health Law Training and Workforce Development with the Public Health Law Program at CDC. Ms. Ransom began her public health career in 2001 as a Presidential Management Fellow. As the Team Lead for Public Health Law Training and Workforce Development, she works to increase the competency of the public health workforce to use law as a tool to advance community health. In this capacity, she develops competency models, develops and delivers training, and oversees the workforce development components of CDC's first cooperative agreement, aimed at building the legal capacity of the public health workforce. She has presented and published on a broad range of topics in public health. Ms. Ransom is a graduate of the University of Alabama School of Law and Emory University's Rollins School of Public Health. She holds an undergraduate degree in speech communication from Columbia State University and has earned training certification with the American Society of Training and Development. Thank you for being here today, Montrese.
Thank you for having me. So I am super excited to be speaking with you all today about the Public Health Law Competency Model. And I see that we have about 45 folks on the line, and I'd like to get a little bit of an idea as to who has joined us today. So if you would, use the chat box to let me know who you are, a little bit about your background, maybe your position, or why you chose to join this particular webinar. And Sarah, can you do a quick test just to make sure I can see what's happening in the chat box? There we go. Excellent. So folks, if you could just follow Sarah's lead, I'd like to know who I have on the line.
And it looks like some people are actually submitting their information via the question box as well.
Okay, great. Let me open that up. Well, I'm not able to see the question box, Sarah. Can you help me out there?
Sure. It looks like we have quite an array. I will actually copy these and send them to you so you'll be able to see it.
Excellent. Okay. And it looks like, do I have control of the slides?
You have control if you'd like.
Okay, great. Sarah, if you don't mind, I'm going to ask that you advance the slide. It's not moving for me. Okay, there we go. Yes, so we want you to enter your positions there. It looks like Sarah's collecting that information for me.
And you should have control now. I'm moving my mouse so it's interfering with yours, but I will send you all the information shortly.
Great, thank you. Okay, so yes, I'm here to talk with you about the public health law competency model, and I think we've got the right folks on the line to hear about the competency model. Our goal was to create a user-friendly tool that could be useful in developing curriculum in public health that had a focus on law. And today I'm going to talk about how we develop the competency model, some of the components, and share information with you on how you can access the competency model. I must first start with a disclaimer. The disclaimer we use in CDC's public health law program is twofold. First, we need to let you know that the contents of this presentation have not been formally disseminated by CDC and shouldn't be construed to represent any agency determination or policy. It's also important to note that while I am a lawyer, I am not your lawyer, and these materials and all of the materials that we develop in the public health law program are for instructional use only and are not intended to be a substitute for professional legal or other advice. Okay, as Sarah mentioned, my name is Montrese McNeil Ransom, and I serve as the team lead for public health law training and workforce development with CDC's public health law program. CDC's public health law program, our mission is simple. Our goal is to help folks understand how law can be used as a tool to advance public health. We do it by working in three primary areas. The first is training and workforce development, and I serve as the team lead for that bucket of work. We also work in the area of legal epidemiology, which is our legal research initiative, and that work is led by Tara Ramanathan. And then the third sort of bucket that we work in is outreach and engagement, and that may be the most important because that's how we identify the needs of the constituency that we serve, and how folks learn how they can reach out to us. And that's led by Abigail Farrell in our office. And we serve absolutely everybody. You'll see on the slide there that we serve CDC programs and state, tribal, local, and territorial communities. But we are absolutely responsive to the needs of the wider public health community. One of the things that I like to point out when I offer these presentations is that while there are lawyers who represent, for example, CDC in our Office of General Counsel, or who serve in that capacity, our job in the public health law program is really to support state, tribal, local, and territorial public health and their use of the law. And we look more at state and local laws and ordinances and how federal laws impact state and local public health. But oftentimes we'll get questions in our technical assistance box and our questions box on our website from people who are clearly students in some of your programs who are looking for information or some guidance to start research. And one of the things that we pride ourselves on in our office is the fact that we are responsive. We are an intellectually curious bunch, and most times when you guys have a question in the field, there's someone on our team of staff attorneys who's also interested in learning more about the topic. And so customer service is important to us. So I'm going to talk to you about the public health law competency model today. And this slide shows a little bit of a roadmap as to how we're going to proceed this afternoon. I'm going to talk to you about why we decided to go down the path of developing the model, talk to you a little bit about how it was developed and how it's organized. And then one of the key questions we were asked as we were developing the model is how it related to some of the current initiatives in public health. And so I'll talk to you a little bit about how it relates to the 10 essential public health services as well as voluntary national accreditation. And then we'll discuss how the model is being used and how we hope it'll be used in the field, and then talk about a few next steps. So the public health law competency model was developed to be a user-friendly model of law-specific skills and knowledge that we found necessary to effectively use law in public health practice. There were three main goals in our development of the competency model. And the first was to provide a common language that demonstrates the critical relationship between law and the day-to-day practice of public health. The second was to drive to support the development of public health law-related curricula or public health curricula that also has a focus on policy or law. And then also, one of the important goals was to create a tool that would complement work being done by ChangeLab Solutions under CDC's first cooperative agreement focused on public health law. And under that cooperative agreement, we're building what we're calling a Public Health Law Academy. And our goal was to ensure that the trainings that are a part of that academy are competency-based, and we needed a tool to help us to move toward that goal. What's important to note here is that I am a trainer. I have received certification as a trainer. I've been doing public health law specific training for the last 5 years, and I found that in trying to develop training and integrate legal principles into existing public health curriculum required a grounding in the language of curriculum developers. And so this idea of a competency model came from the fact that I needed language, and I felt like other folks in the field probably felt the same way and learned that that was true. But I needed language that was easy to read and easily accessible and commonly accepted throughout the field to support things like objectives and presentations we were doing, or again, learning objectives and trainings we were developing. And so that sort of basic need was one of the seeds for the development of this competency model. So what you see before you is the current version of the public health law competency model. We defined competencies in this project as the knowledge and skills workers need to perform their work, a basic set of attributes that public health workers need to accomplish their day-to-day practice of public health. The public health law competency model includes 2 domains and a total of 6 competency statements, and it's intended to be, as I mentioned, a set of broadly accepted guidelines for minimum competencies in law needed by public health practitioners, primarily those working in state, tribal, local, and territorial health departments. You can't see it here, but in Table 1 of the PDF of the actual competency model, which is in your handout section to the right of the slide set here in the webinar, you'll see that the competencies are tiered to describe how each competency is demonstrated as responsibilities become more complicated, or demanding, or as careers advance. And I'll talk to you a little bit about more of those tiers as we move forward in the webinar. So in addition to basic needs that I had as a trainer and that I was hearing from folks that were similarly situated in the field, we found that there were variations and quite a few differences in the types of institutions that were offering public health law training and educational programs, and differences in how law was being integrated, a wide variety in the language of the objectives, in the quality of the training, and in outcomes expected of the participants, particularly the learning objectives. We found through research in our work toward developing the Public Health Law Academy that the number of organizations that are offering public health law training is growing, but again, that training really varies in the quality and the style in which it's offered, which is fine. We'd love to see multiple approaches in this area, but we were feeling that there needed to be some sort of foundation that folks could go to when they were developing this training. We're happy to see that over the last 15 years, the breadth of law-related curricula in public health continues to increase. We're seeing far more JD MPH programs. Our summer internship program is attracting a wide variety of both MPH students and law students who are interested in learning more about public health law. And so we thought that this would help expand what's becoming a discipline, a more clearly defined discipline in public health law. And also in 2013, at the request of the CDC Office for Public Health Preparedness and Emergency Response, we developed a public health emergency law competency model. And we've seen wide uptake and acceptance and use of that model across the country. In fact, it's being used now for the second year of road shows that Greg Sunshine, who for Public Health Emergency Law at CDC's Public Health Law Program. He's leading these public health emergency law trainings across the country in state and local jurisdictions, and that training is competency-based based on the language of that particular competency model. So we saw a need and an opportunity, and we knew that there were certainly ways that we could begin to use the model pretty quickly upon development. So let's talk a little bit about how it was developed. As part of my work in figuring out, exactly how a competency model should be developed, I really did a lot of research on some of the approaches that other folks and scholars had used to create competency models. And our process that we used followed the best practices that we learned from that process. Basically what we did was we created a working model through a deliberative process that built on and aligned with existing frameworks and models for competencies in various public health professions and tracks. And we completed the project over a 3-year period from late 2013 to 2016, early 2016, in 5 phases as depicted here on this slide. And I'm going to talk to you now a little bit about each phase. You can see some of the key milestones that we achieved as we went through this process of developing the competency model. Of course, as with most things, most projects, the first thing we needed to do is sort of an environmental scan to see what existed out there. And so we conducted a literature review that led to the development of a competency library. We looked at competencies from varying professions, public health professions, from medical, public health, and social science peer-reviewed journals, articles on the development of competency models. This included a review of competency statements in a variety of disciplines. We looked at performance benchmarks. We looked at other standards of performance and that sort of language. And we compiled those into a competency library. And then we spent some time internally sort of culling that list and grouping them as best we could into categories without changing the language, but keeping the integrity of the original language so that our expert review panel could have the opportunity to really make the determination as to what was most important for our work in public health as far as law was related. So in the process of creating the competency library, we actually looked at more than 20 competency models, and we include a list of the competency models we included in our library in the actual competency model document that is, again, in the handout section to the right of the slide set here. And so our next phase, we convened an expert review panel. We knew to do this on our own, and if we wanted something that was widely accepted, we needed to involve the folks that we thought might be end users and who could certainly contribute to developing the competency model in a substantive way. And so we pulled together a group of 20 multidisciplinary experts and from a wide variety of backgrounds. We included folks who represented local public health, who represented state public health officials. We included folks from CDC who were experts in competency development. We included folks who were professors at schools of law and schools of public health. We also included staffers and program managers from the Association for Schools and Programs for Public Health. And so our goal there was to make sure that it was a multidisciplinary group. This group met monthly from April through August of 2013 and really guided the competency model development process. They were tasked with reviewing each model and competency statement that was included in the competency library, and their goal was to prioritize the relative importance of each statement and delete those that were seen as unrelated to law-based knowledge, skills, and abilities. And that was the basic process we went through back and forth for about 3 months. In phase 3, we began to create a working model. we participated in an iterative process where we sort of prioritized the remaining statements from the competency library to identify themes and my favorite word, categories or buckets that emerged, and then we also worked to create a skeletal structure for the model. During our last few monthly calls, our expert review work group members offered comments on the developing competency statement and really honed in on gaps that they identified in the language, and including things like ensuring we were considering equity and considering special populations, including tribes, in our competency statement language, in our behavioral language, or at least in our statements toward what training or educational programming can be developed to meet each competency statement. So the information collected from our expert review work group was used to prepare our first draft of the competency model. We continued to review and edit and refine that model and began to add behavioral indicators associated with each competency statement and across the tiers that I'll show you in just a second. I think the most important here is that most important point here is that throughout this third phase, there were two consistent guiding questions, and they were that we asked of our expert review work group members. And they were, one, do the statements that are emerging accurately portray law-based knowledge, skills, and abilities needed to effectively practice public health regardless of the public health subject matter, so regardless of the position? And are the statements clear and concise? And so those were our two overarching goals as we moved through the process of developing the language. In phase 4 of our process, we validated the working model. We worked with the Northwest Center for Public Health Practice. We worked with them through a subcontract with Change Lab Solutions under our cooperative agreement. And their goal there was to validate application of the competency model to a public health law training or educational program. And so they did an in-person pilot training, and they evaluated that training, and they also conducted key informant interviews with curriculum developers and subject matter experts. The goal of the Northwest Center's work was to validate the extent to which the competency model, the application of the competency model actually assisted in the development and delivery of law-related curriculum. So did it actually help in the development and delivery of law-related public health curriculum? And did it increase the self-reported competency of the participants? Did it help increase the competency of those who participated in the training? The validation findings demonstrated to us that the competencies did provide a good framework for improving the relevance of public health law-related training as it relates to day-to-day public health practice, and it also helped to improve the consistency of training outcomes. We do recommendations from the validation process. Some of those included ensuring that we're using plain language, providing guidance on how the competency model can be used in the field, and a suggestion about finding ways to track the ongoing use of the competency model to ensure all of the competencies are being applied. We found that some were easier to apply than others, and so we're still learning how that language can be used in the field, and how different segments of the public health training and public health education workforce, how they're using different pieces of the competency model. And so we're still in the process of figuring out exactly the best way to evaluate that. But from the results from the competency model validation process, we refined the model and we started dissemination. And so we used the input from SMEs and the target users. We also sent, we updated the model or edited the model based on the validation process. And then we shared what we considered to be a final working model with subject matter experts that we worked with in OSTILS and the Office for State, Tribal, Local, and Territorial Support within CDC, and with partner organizations including ASTO, the Association for State and Territorial Health Officials, the American Public Health Association, the National Conference of State Legislatures, the National Association of County and City Health Officials, Change Lab Solutions, and the Network for Public Health Law. We asked them to do one final review, and then we began the dissemination process. And so this webinar is a part of our efforts to disseminate the public health law competency model, and we certainly hope that those of you who are participating will check the competency model out, find ways to use it, and report back to us how you're using it in ways that it can be improved. So as I mentioned, the competency model is organized into two domains, foundational public health law, and the second domain is law as a public health tool. We have organized the public health law competency model into 3 tiers. These tiers are the tiers that are used by the Council on Linkages in their core competency model, and we thought that this would be a better approach to use because it aligned with existing models that people were familiar with. So the 2 domains, as mentioned, are law as a foundation for governmental public health practice, and you'll see there that the competency statements there focus primarily on basic foundational principles, defining basic constitutional concepts and legal principles, statement 1.1, 1.2, identifying and applying public health laws pertinent to the practitioner's jurisdiction, agency, program, and profession, 1.3, describing the protocol for contacting and best practices for engaging with legal and or ethical advisors and other key public health law resources. And then domain 2 focuses more on how law can be used as a public health tool. And you'll see there 2.1 describes law-based tools, procedures, and resources available to public health practitioners or public health agencies. 2.2, identify law-based tools and enforcement procedures available to address day-to-day non-emergency public health issues, because we've got a separate public health emergency law competency model. And then 2.3, recognize the legal authority and limits of critical system partners and other who influence health outcomes. And in the competency model, in the actual document there, we list the tiers and behavioralist statements associated with each tier. The language wouldn't quite fit into the slides, and so what I wanted to offer you here is the basic statements, but you'll want to definitely check out the domains, competencies, statements, key behaviors, and training topics that are listed in the document on the website, and also in your handouts listed there. So these are the tiers that I mentioned that, again, flow from the Council on Linkages Public Health Core Competency Model. Tier 1 is frontline staff, entry-level staff. So, for example, under Competency Statement 1.1, which is defined constitutional concepts and legal principles framing the practice of public health across relevant jurisdictions. For Tier 1, we ask that the behavioral statement says that they should be able to describe the public health laws and regulations governing public health program and related practices. For Tier 2, which is program management and supervisory level, the behavioral statement is manages public health programs and practices in ways that are consistent with public health laws and regulations. So the idea there is understanding and implementing their enabling authorities. Tier 3 is the senior management executive level. So under that first competency statement, 1.1, the behavioral statement there would be ensuring public health programs and agency practices are consistent with health laws and regulations, so overseeing the implementation of enabling authorities. So again, our goal here was to help people who are developing trainings identify who their audience is. If you're training or teaching, those folks will be a frontline staff or entry-level staff. You'll want to focus on those behavioral statements. If your staff is a little more advanced, or if your students are a little more advanced, you may want to focus on the behavioral statements associated with Tier 2 and Tier 3. So in developing the competency model, one of the questions that arise was how it related to existing public health framework, existing public health initiatives, and so we really thought about how it relates to particular things. The first is the 10 essential public health services, and the second is voluntary accreditation. So we know that the public health system performs the three functions of assessment, policy development, and assurance by delivering the 10 essential public health services that you see here on this slide and depicted in the chart there. The public health law competency model ideally can help state, tribal, local, and territorial public health agencies provide the services that are concerned with developing policies and plans, number 5 of the 10 essential services. Enforcing laws and regulations that protect health and ensure safety, number 6. And ensuring a competent workforce, number 8, competency model. And also evaluating the effectiveness, accessibility, and quality of personal and population-based health services, number 9. So our thinking is that public health practitioners who become proficient in the public health law competencies will be better able to assess problems that need policy or legal solutions, and they'll have the necessary skills and knowledge to propose solutions that are grounded in law. And we think that with these skills, practitioners that are working in public health agencies will be able to help those agencies demonstrate staff competence for using law as a tool to advance community health goals. The other thing is that's important to think about is that understanding law and policy is also critical to our efforts to support public health department accreditation. As many of you know, the goal of voluntary national accreditation is to improve and protect the health of the public by advancing the quality and performance of tribal, state, local, and territorial public health departments. And so the accreditation board's process seeks to improve the quality and performance within all state, local, tribal, and territorial health departments by outlining specific standards. And those standards are grouped into 11 domains, and those domains define the expectations of health departments that want to be accredited. We found in our process of developing the competency model that the public health law competency model can actually advance accreditation goals as you're seeking accreditation, as you consider the standards under Domain 6, which expressly focus on understanding and enforcing public health laws. Standard 6.2 under Domain 6 specifically requires that health departments seeking accreditation educate individuals and organizations on the meaning, purpose, and benefit of public health laws and how to comply. So we're hopeful that the model will be helpful in that way as well. We think that those practitioners who lead accreditation efforts for their jurisdictions can find this model useful for ensuring that public health law-related training and educational efforts are competency-based. So we are hoping that folks like you on the line will actually use the competency model. We think that based on how other models have been used, how we've seen other competency models used, that public health practitioners and that professors, trainers in public health law can use the model to identify skill and competency gaps more efficiently, to incorporate elements of public health law into existing and future curricula, to recruit as maybe position description language or recruiting language for positions that are policy or law-based, to select or evaluate those folks on their performance, and to develop career ladders or employee development plans or training plans, and again, position descriptions. In addition to graduate schools of public health and schools and programs of public health and schools of law, we also anticipate that faculty and students in schools, including schools of international relations or affairs, business schools, or schools of information or other health professions may find this competency model helpful. And I'd love to hear from you folks on the line. I'll provide my email address on the last slide. Our most important next steps in disseminating the model is to hear from people in the field about how it's being used and how it can be improved. So our goal is to continue to disseminate the model, continue to work on developing competency-based training opportunities to reach public health practitioners in the field, and to continue to develop training specific for the Public Health Law Academy. It's also important to note that we in the Public Health Law Program have one additional public health law or competency model development process underway. We are right now in the middle of developing a legal epidemiology competency model, which really focuses on competency development or competency skills, competency statements focused on skills in legal research, specifically legal assessment work that focuses on comparing jurisdictions, policy surveillance, legal mapping, a lot of the work that we do in the Public Health Law Program and that we're seeing being done in the field that relates to comparative research in public health law. And so we're in the middle of developing the legal equity competency model, and we expect to release that in January of 2017. So I'm going to close with one of my favorite quotes. It's from Dale Fahey, former director of CDC, and he says, "The first tool of public health is epidemiology, and the second tool might well be the law." And I love this quote because in my work over the last 15 years, I've found that that there really is no public health without the law, from establishing a health department through a statute to passing clean indoor air ordinances to laws that allow for things like breastfeeding in the workplace and that sort of thing. It really is the law that allows us to make healthy decisions our default decisions. And I hope that this competency model helps us move further toward establishing public health law as a discipline within the field of public health. And so with that, Sarah, I will turn it back over to you for Q&A.
Wonderful. Thank you, Montrese. This is really fascinating, and especially with the recent or not so recent focus on interprofessional education and collaboration. And ASPPH actually pulled together a diverse expert panel for population health across all professions. So right in line with that. Thank you. We will now take this time to address questions from the question box. Please feel free to type your questions in the question box. And one of the first questions is, can you share examples of how professionals are using the model currently?
Absolutely. One of the things that we're working toward, as I mentioned, is the development of this Public Health Law Academy. One of the criterion for training that is included in the Public Health Law Academy is that it's competency-based. And so people that are in the field that are developing training for the Public Health Law Academy are using the competency model to ensure that the components of the training they're developing are competency-based, and they're actually using those as the learning objectives related to the training. And it's particularly important because for each of the trainings in the Academy, we're seeking continuing education units, and that consistent language has been very helpful in submitting our continuing education unit packet.
Great. And then how can we access those trainings in the Public Health Law Academy?
So the Public Health Law Academy is a living, growing thing. We anticipate that it will be fully available and ready for use in January of 2017. But the Public Health Law Academy will be a web-based learning portal that's going to be connected to CDC Train. As I'm sure many of you folks are aware, CDC Train gives access to more than 1,300 courses developed by a wide variety of folks, including CDC programs, some of our grantees, and other funded partners. So the Academy is going to be a central repository, a portal directing users toward public health law-related training that provides continuing education units. Each of the trainings are going to be innovative, interactive, high quality, and engaging. And again, we've got very specific criteria for training that is allowed to be included in the academy. Right now, and I don't know if we're allowed to share this widely, but I'll go ahead and share this. We do have one training on prescription drug overdose that is competency-based and available for continuing education units that is available through Train right now, but the Academy portal is not quite yet up. And we're basically doing that training to work out the kinks before we launch the actual Academy. I hope that's helpful.
That is really exciting and also very helpful. Let's see here. The next question is, which steps were consulted on with tribal members or leadership specifically? And then if you have the information, what regions were they from?
Absolutely. We actually, for this process, we relied on our partners at the National Indian Health Board. And Carolyn Hornbuckle, who at the time was a public health project coordinator with NIHB, and she was working on public health law projects with, I think at that time, the National Council on American Indians to develop a public health law database. And so that's who we brought in to represent the tribal perspective. And she was a part of the 3 calls of the expert review work group, and as well as the review of the refining of the review of the refined copy of the public health law competency model. If you look at the actual handout and the model, she was very integral to ensuring that, particularly under Competency Statement 1.1, define basic constitutional concepts and legal principles framing the practice of public health across relevant jurisdictions. We list specific training toward this competency, and listed among those is federal Indian law principles, including sovereignty, trust responsibility, etc. And so that's one of the ways that we integrated tribal perspectives.
Wonderful. The next person asked if you could talk a little bit more about the public health emergency law competency model, how exactly it is used.
Sure. So the public health emergency law competency model, again, we developed that in 2013. It has 3 domains, and I think there are 9 or 10 competency statements in the public health emergency law competency model. You can literally Google PHEL competency model, and it'll come up. I don't have the website in front of me. What we've done with that is we have a public health emergency law course. And as I mentioned, Greg Sunshine has gone across the country using that course to train state, tribal, local, and territorial health officials on the latest and greatest in public health emergency law. And each unit in that course has been updated to ensure that it is competency-based. And so for each unit, he has pulled statements from the competency model to ensure that the training that's covered in the unit meets those competencies, meets the goals of those competency statements. So we've seen it used that way. I've also seen the public health emergency law competency model being used at the NACCHO Prep Summit as language for some of the sessions that were offered there by people that aren't in our program, so by external folks who found that language helpful in defining the learning objectives for their workshop. So I've seen it used in that way as well. If you folks are using it in the field, I'd love to hear more about how it is being used.
Great. The next question is, many schools and programs have a request to include training on as many competencies as possible, while at the same time being able to have staff to teach and be able to measure process and outcomes. Do you have any suggestion on how to best integrate and assess?
Ask the question again, please.
Sure. So it says many of our schools, I'm anticipating, our schools and programs of public health are requested to include training on a lot of different competencies. I'm rewording it a little bit. And so, but at the same time, kind of competing need to be able to have staff to teach all the competencies and an ability to measure and process the outcome, measure the process and the outcomes, and asking for a suggestion on how to best integrate and assess, I guess, these public health law competencies in addition to other competencies.
That's okay. I got it. Yeah, I think that's a great question, and it's certainly something that I ask myself. We don't want to, and certainly something that questions that we got from folks like Ron Bialik at the
PHF.
Council on Leaking. Yeah,
or Council.
Yeah, absolutely. You know, we're adding more competencies. A couple of things come to mind. The first is our goal is to help develop training that is competency-based, so training that is based on these competencies. In an ideal world, some of those training materials can be easily picked up and used in schools and programs of public health, and we're certainly open to ideas on ways that we can improve it so that it can be helpful to you. And the other thing that comes to mind is as we move toward the development of this Public Health Law Academy, I'm wondering if there aren't faculty that are available to teach it, if there are ways to integrate having students take the trainings that'll be a part of the academy, which come with a pre and a post test as required for our CEU purposes, as a way to get that sort of training or meet those competency goals without having to have the faculty in place. These will be free training opportunities, so maybe that's the way. I hate that I can't unmute the line to have more of a conversation about it, because I'd like to further discuss, you know, ways that we could help add value to what you're doing without adding a further burden.
Great. In the follow-up email that all registrants will receive, I'll make sure to include your contact information so individuals can follow up with you in particular.
Excellent. And I'll also send you the link to the Public Health Emergency Law Competency Model so you can include that too.
Perfect. Can you tell us a little bit more about the legal EPI competency model?
Sure. So the legal EPI competency model, I will say, is a little more niche-y, and I think a little more relevant to schools of law. But the audience for the legal EPI competency model is much broader than just public health lawyers and public health folks in policy. But the concept behind the legal epidemiology competency model is that we have found that there are people across the country that are doing what we would call 50-state assessment work on law-related issues in public health. An example of a 50-state assessment project that we've done in the Public Health Law Program is in prescription drug overdose, where we looked at 7 different domains. Tamper-resistant prescription pads is one domain. Pill mill reduction is one domain. Just 7 domains in prescription drug overdose. And we looked at 50 states, and that work took a very long time to do. We have one lawyer who does the original research, and then another lawyer who comes in and does a cross-check, and then we do a wide variety of quality checks to make sure that the process that we're using is replicable and credible and has a scientific basis. And for the past, I'd say 5 or 6 years, our program, as well as Public Health Law Research at Temple and other partners in the field, have been doing this similar legal assessment work. But the approaches that folks are taking in the field to do it have been very different. And so the results are different, and oftentimes the research isn't replicable. It doesn't have that scientific basis that we need, given the fact that we're working in public health. And so a bunch of experts decided that we needed some sort of performance standards for legal epidemiology research, and so that's the work that's being done to develop this legal epi competency model. It's also important and related to the Public Health Law Academy, because a piece of the Public Health Law Academy will be a legal epidemiology center, which will provide resources and training on 50-state assessments, how to properly do them, defining and characterizing legal mapping and policy surveillance in public health, and that sort of thing. And we would like for that work to have, again, some sort of foundational approach that's universal. And so we're working toward creating a legal epi competency model for that.
Wow, you're busy. And a few more questions. What are some examples of training or educational topics that might be addressed under the competency statements, and maybe with a spin for other disciplines? Specifically, somebody asked about health educators.
Absolutely. So one of the trainings that one of the competency statements that comes to mind that may be of relevance for health educators is competency statement number 2.3 under domain 2, which is law as a tool to advance the public health. And that statement reads, recognize the legal authority and limits of critical system partners and others who influence health outcomes. And training toward this competency might address things like communicating with legislators, education versus advocacy, particularly if you are receiving federal grant funding and you're up against anti-lobbying rules. We have to be clear about education versus advocacy and the work that's being done in that context. Working across systems, so working with urban planning and what their framework may look like. Our transportation partners, our partners in agricultural systems, for example. So those are some of the training subjects that may be covered under that particular competency model, or that particular competency statement. Another that comes to mind to me is competency statement 1.2, which says identify and apply public health laws. And here, it's particularly those that are pertinent to a practitioner's jurisdiction, agency, program, or profession. And so, depending upon what the topic is, some of the topics that are, what the area is, some of the training topics may include social justice and equity, our framework for due process, basic provisions of the governmental unit's health code and regulations, so how the health code is applied to the communities. An example that immediately comes to mind to me is as we're preparing for Zika preparedness and response, community education about about public access to private property for potential spraying, or educating community about how they can protect their own private property and the framework for that under our legal system. I could see that under that particular competency statement as well.
Wonderful. Thank you so much, Montrese. This has been very interesting, and I think a lot of our constituents will find a lot of use out of all these resources, which I will follow up and make sure everyone has. I think, seeing no other questions in the question box, we'll go ahead and wrap up. I want to remind everyone that this webinar was recorded and will be made available on the ASBPH website in the archived webinar section soon. I will follow up with an email to all those who registered with a link once it is available for review. Please be sure to contact us with any additional questions and to register for the next webinars in the ASBPH Presents webinar series. Additionally, please save the date for the 2017 ASBPH Annual Meeting and the 2017 Undergraduate Public Health and Global Health Education Summit to be held in Arlington, Virginia. And lastly, along with the interprofessional wavelength, note that the registration is open for the 2016 ACSA and ASBPH Fall Conference, the first ever joint conference between the Association of Collegiate Schools of Architecture and the Association of Schools and Programs of Public Health. Thank you, and thank you, Montrese.